everybody, we're back here again doing our next demo, which is dermaplaning. Dermaplaning is a physical exfoliation of the skin. Similar, well, it's actually not similar. It is different from microdermabrasion, which you saw the earlier demo. Microderm uses suction and synthetic crystal to remove that top skin cell layer. We are using a tin blade, okay? It is physically removing that top skin cell layer by shaving it off. So the added benefit to this versus microdermabrasion is you are going to leave this treatment feeling extremely smooth. You are going to remove that vellus fuzzy hair on the skin. Now, women in general have different variations of how much fuzzy hair they have on their face.
Does she have some over there already?
Yes, so I can show you a little bit about what's coming off of her skin as we speak. We've already started the treatment and Allison is moving right along. So some people have a lot, some people have a little. This is the treatment that I was speaking about earlier that makes your makeup glide on after. This is definitely one of these treatments that you could do before an event, before a wedding, before, you know, something that you really just want to look really extra fresh for. This is my go-to for that. You're gonna do all the same things other than using a different method of cellular removal. We're still going to do a chemical peel. We're still going to do products. All of that is still going to happen. We're just changing up the method of removing that top skin cell layer. It feels actually kind of relaxing. It doesn't hurt at all. It actually is probably the more relaxing of all three physical exfoliations that we do here in the office. This one is the most relaxing. It is probably a little bit more aggressive than the other two, just for the sole fact of we are physically removing it. It is not sloughing off days after the treatment. It's off. We've removed it. So the skin is very open. So in particular, like the type of peels that we would choose for this treatment versus the other two physical exfoliations that we have would be a lot less. We would use something very mild on the skin after this treatment because the skin is going to soak it up. It really, really will.
So using like skincare products afterwards, it's really gonna help absorb.
Yes, everything is gonna absorb deeper, much more aggressively. So you really do have to be mindful of that. I find in my skin after I do dermaplaning that you feel almost like a tacky, almost texture to the skin. And I need to use far less product. It's amazing to me how much absorption that just fine vellus hair actually soaks up product, and when you don't have that on your skin, you need less. You just need a lot less product. It absorbs really nicely, and it really gives you smooth as a baby's butt sensation to your skin. Now, as far as who's the best candidate, pretty much everybody's going to be a good candidate for physical exfoliation. The person that I'm not going to do dermaplaning on is somebody that has extreme cystic acne, complete breakout, large nodules all over the face. I'm not doing this treatment on them, okay? That would be dangerous with a tin plate.
Tina, I feel like people freak out thinking that if they remove this hair, it comes back thicker.
That is so funny because Miss Shelley here just asked that question before you just turned on the video. So that's a huge wise tale, okay? We've been told all our lives, don't start shaving because you're going to have to shave for the rest of your life. And that goes for men as well. You know, don't start shaving your face until you absolutely have to, because once you do it, you can't stop. Well, men have hormones that create male pattern hair growth. Women sometimes have hormones that create male pattern hair growth. But in general, we just have soft hair on the face, maybe some more congestion on the upper lip. But if we shave it, it does not come back any thicker. It will feel like a whisker when it breaks the surface, but once it breaks the surface and gets long enough, it's going to be exactly where it was before you did that, okay? So it is definitely one of the biggest fears on patients going into this for the first time, thinking that, you know, somehow, some way, I'm going to, because I've cut or I've shaved their face, they're going to all of a sudden grow a beard the next week. That's impossible. That can't happen.
How long does this treatment take, Tina? And
This treatment takes a little longer than the other two physical forms of exfoliation. Dermaplaning, you kind of have to be careful. You got a 10 blade in your hand, so you kind of have to go a little slow. I'm not going to lie, cuts happen. Little fine paper cuts happen actually quite frequently with this treatment process. They close up and they go away very quickly. But that is one of the, I feel like, side effects on doing this treatment versus the other one, that you do run the risk of having those little fine little paper cuts. But that's why you got to go slow and steady, and it takes, you know, a little bit longer than a half an hour, probably 45 minutes to an hour that you're going to probably need a cushion for this one versus the microdermabrasion.
Are there any products that you would avoid after this treatment for any period of time?
To be quite honest, no. I just wouldn't suggest the technician use a very harsh peel unless they are looking to do something harsh and aggressive. Product-wise, I mean, you're really able to use whatever products that you typically do use, or even, you know, use something different. Obviously, you need to be mindful if you're going to use an acid like a glycolic, or if you're going to use a salicylic, or you're going to do a spot treatment with benzoyl peroxide or something like that. You're going to feel more sensation on the skin because we've removed that top skin cell layer.
with any type of dermaplaning, do you need to avoid the sun afterwards?
Well, I'm always going to try to tell people to protect their skin after any kind of treatment. The skin is fresh, you know, and obviously that can complicate things if you go right back out in the sun and, get a sunburn or suntan. This is not one of those things that I preach terribly about. I mean, ideally, you could really go right back out in the sun after a treatment like this. Now, let's say I used a peel that was really aggressive on top of doing dermaplaning. Then I would have to tell you, you know what, that's not a good idea. You probably need to protect your skin for up to a week after this procedure. Make sure that you're not going into direct sun, and obviously protect from, sunburns, suntans directly afterwards. But I kind of say that all the time. I mean, you need to use your sunscreen.
Shelly, how does it feel for you?
It's actually really
Relaxing.
Feels like little feather, swipes, doesn't it, on the skin? Or
No pain at all, right?
How would you describe it? Can you even feel it?
I can feel it, but for me, I can't sit still. So maybe sit still is different than the treatment itself. It is.
Right.
But it doesn't hurt. It doesn't feel like she's scratching or anything.
Yeah. I feel like when we do this treatment, this is the one where I kind of have to tell people not to talk when we're going around the mouth area. That's when you get little cuts or nicks when somebody's talking during this treatment. But for the most part, it's very relaxing. I think it's extremely relaxing. So physical exfoliation of the skin. This is dermaplaning. We do this in our Patient Preferred Program Plus. You can couple this in with chemical peels. You can do this, really actually as frequently as probably every 2 weeks if you wanted to. I feel like that's kind of overkill. Once a month is sufficient.
And we're doing, if we're doing a package of 6 treatments.
For $550, I believe, or $600. Let me look at that. I'm sorry.
I'm sorry, I'm throwing her.
Dang it, you threw me. Dermaplaning, yeah, so $600.
600.
Yes, so a package of 600, and then you could get 12 if you bought the Patient Preferred Plus. Now, obviously, that package includes other treatments, so you wouldn't really do 12 of them. You would interchange other different treatments throughout that package, but for $300 more, you're getting double the amount of treatment.
Right.
So, something to think about when you're thinking about purchasing, for sure. But 6 could ideally last you anywhere from 6 months to a year. 6 months if you did it once a month for 6 months, or a year if you did it every other month.
Now let's ask Shelly on a scale of 1 to 10 of.
One tiny bit of tingle, 10 on fire.
For this stuff?
Yes.
Yeah.
It just smells like oranges.
Any tingling at all? 0?
No tingling, 0. See, it's
Wow.
not hard.
Perfect.
That's better, right?
Yes.
Now I feel like we went to one extreme to another.
Right, I know.
Obviously, there is sensation to
Yes,
this stuff, but
yes, yes.
I don't know if it was an 8.
I mean, I've had worse sunburns.
Yes, yes.
So again, I want to just remind everybody that all our sales go on till Friday at 2 o'clock. Phones shut off. So you've got today, tomorrow, and Friday until 2 to call here. We're here until 6 today if you wanted to stop by and take advantage of all our sales that we're doing. Obviously, if you have any questions, you can give us a call.
We still have coffee and tea
Yes,
and bundt cakes and cookies.
All kinds of goodies
Yes.
at the front with all kinds of sweets, and then coffee, tea, hot cocoa.
Yes.
So anybody is welcome. So if you guys want to stop by and partake in any of those things, please feel free.